All right, let's get into this. You've definitely heard of Fitbit, right? Well, the guys behind it, James Park and Eric Friedman, basically put personal health tracking on the map for millions of us. Now they're back with something totally new called LUFU, and it's tackling a completely different and maybe even bigger health challenge.
Remember the Fitbit era? It got us all obsessed with our own numbers. How many steps did I take? How well did I sleep? It was all about the quantified self, where the only data that mattered was our own.
But here's the thing. Our health worries are rarely just about us, are they? Sooner or later, many of us find ourselves trying to keep track of the health of our parents, our kids, maybe even the family dog. And that's exactly the jump that LUFU is making.
And this, right here, this is the fundamental shift in thinking. Fitbit was all about me. How can I use my data to get healthier? LUFU is all about we. How can we use a smart system to coordinate care for the entire family? It's a move from just optimizing yourself to actually collaborating as a team.
So, why this huge pivot? Well, it turns out the founders zeroed in on this massive and often totally invisible problem that millions of us are dealing with, the modern caregiving crisis. And you know, what's so powerful here is that this whole idea didn't come from some corporate strategy session. It came from a real, personal struggle. Co-founder James Park found himself trying to care for his parents from all the way across the country. He was trying to piece everything together, and he was walking that fine line of wanting to be helpful without making his mom feel like she was under a microscope. He needed a tool that just didn't exist.
And let me tell you, his story is not unique, not by a long shot. There are an estimated 63 million unpaid family caregivers in the U.S. alone. Just pause and think about that number for a second. That's almost 1 out of every 4 adults providing absolutely essential care for a loved one. And the crazy part is, this isn't some static problem. It is exploding. With people living longer, the number of family caregivers has shot up by 45% in just the last 10 years. That burden of care is falling on more and more families, and honestly, most of us are just not prepared for it.
So how are these 63 million people supposed to manage all this? Well, right now, for most families, it's just pure chaos. I mean, think about it. Critical information is scattered all over the place. A lab result is in one online portal. A doctor's appointment is on a shared calendar. A question about meds is buried in a text chain. And oh yeah, those blood pressure numbers, they're jotted down on a scrap of paper on the kitchen counter. It's a full-time job just trying to keep it all straight.
And that is the exact mess that LUFU was built to solve. So let's talk about what this intelligent family care system actually does.
Okay, so at its heart, LUFU is basically a central hub that's powered by AI. Its main job is to pull in all that scattered information from everywhere, get it organized, and then, and this is the really important part, it analyzes it all to find patterns and flag things that might be a problem before they turn into a full-blown crisis. And they're not messing around. It's designed to be super comprehensive. We're talking everything from the hardcore clinical data, lab results and vitals, all the way to daily life stuff like meals, meds, and any new symptoms. You can even track your dog's health info in there. The whole idea is to get one complete, unified picture of your family's well-being.
Okay, so it pulls in all this data, but how does the AI actually turn that mountain of information into something useful? How does it bring clarity to all that chaos?
Well, it really comes down to this pretty simple 3-step process. First, you just gather the info as it happens. You can speak a note into your phone, send a quick text update, or just snap a photo of a new prescription bottle. Super easy. Second, the AI works quietly in the background, learning what's normal for your family. It's kind of like a smart assistant that's been paying attention for months. It knows the daily rhythms and can tell when something's a little off. And then third, it uses that knowledge to give you a heads up about important changes, so you're only seeing the stuff that really matters.
And this is where it gets really powerful. Since everything is in one place, you can start asking it these complex questions just using plain English. Instead of you trying to manually cross-reference a food journal with a blood pressure log, you can just ask the system, hey, is there a connection here? And it will connect the dots for you.
And it's not just for the big stuff. It helps with the simple daily coordination too. I mean, this question right here, this causes so much stress and confusion in countless families. Instead of a messy group text where nobody's sure, you have one single place to check. It's all about reducing that daily mental load. So, let's zoom out a bit. What does a tool like LUFU really signal about the future of how we're all going to manage health?
You know what co-founder Eric Friedman says here really just hits the nail on the head. The ultimate goal isn't just about collecting data, it's about changing a feeling. It's about transforming caregiving from this frantic, overwhelming experience into something that feels coordinated, calm, and, genuinely collaborative.
And this, folks, is the really big idea here. For the last decade or so, health tech has all been about these separate apps that just focus on one person. LuFu represents what's next. Integrated systems that get that our health doesn't happen in a vacuum. It happens in the real, messy, interconnected context of a family.
And that leaves us with this one kind of mind-blowing thought to chew on. As technology like this gets smarter and woven more deeply into our lives, you have to ask, could an AI, one that never sleeps, never forgets a single detail, and can spot patterns a human might miss, could it actually become the most essential member of a family's care team? It's a pretty profound question for the future of health.